Well, hello everyone. I'm Tyler Chrestman. Welcome to the Chrestman Conversation. So we are going to be talking about Corona this week. Obviously the biggest thing in the news. Actually, back up for 1 second. First of all, let me just tell you, I am so sorry I haven't put one out in the past month. Had a series of vacations, which was pretty nice. And then my work has been a little nuts, what with this whole virus nonsense taking over the world. So I am sorry for the lack of content in the past month. We're going to put out a couple of these podcasts this week. This first one today is going to be talking about the coronavirus. We're just going to be discussing the virus. We're going to try and keep it apolitical today. Just some straight up facts about the virus. And then probably do one maybe tomorrow, possibly Tuesday, about the political implications of said virus. But today, just talking about Corona. I'm also going to apologize if you hear a cat yowling in the background. She's fine. She's just in a mood. I don't know. Sometimes cats are just weird. And with that, we're going to jump right in. So everyone at this point in the world has heard about the coronavirus, it seems. We all know that there is a pandemic, and we are all just trying to figure out a way to get through it. Now, today we're going to just talk a little bit about the history in the past few months, how this virus came to be such a gigantic issue, and some facts, some things that we actually know, and some things that we should actually do. So let's talk about the origin. This virus comes from China, as Trump might say, and it appears to be it seems to be from bats, and the obvious place that seems to be the culprit are these wet markets in China, which should all be shut down at this point. I don't understand. The Chinese government is an authoritative regime. They should just shut all of these wet markets down. You're talking about the history of contagious diseases that have caused mass panic and death. They all seem to originate from China, and they all seem to come from these wet markets. Whether it's SARS or MERS, H1N1, you're talking your bird flu, your swine flu, and now your coronavirus. They come from these places in China where basically they keep live animals together in close proximity, and you have viruses that jump species to species and mutate. So what basically appears to have happened here is that a virus that originated in a bat, the coronavirus, originates in a bat and somehow crossed the species barrier into a pangolin. Then someone ate the pangolin and then got infected with the coronavirus. That appears to be the origin of the virus. This started in possibly November of last year, appears to be when it originated. And the reason why it has become a gigantic problem in the world today is because China is terrible. Not the people of China, but the Chinese government is a terrible communist regime. And what happened was they tried to deny, and until it got too big, and then they said, okay, there's a little bit of a problem. There was a report that came out, I think it was last week, that said if China had acted on the virus 3 weeks earlier, there would be 95% less cases in the world right now. But instead what they did was they silenced people who tried to talk about it, and maybe possibly killed some people. It's a little confusing at this point, but at least silenced the people who were trying to talk about it and denied things like there was human-to-human transmission, denied all these different things, and pretended it wasn't a problem, and now we have a worldwide pandemic, and it's all China's fault. There's a reason why this is a concern. China, they lied about the virus, and then they thought they could contain it, and then only were transparent when it realized that there was no way to contain it. The things that we know about the virus, and I will say this, we will not know for sure for another year all the end statistics of what this virus is capable of. We won't know, because there are going to be conflicting reports all over the world. It's going to be, it's going to be different in different countries. There's going to be different outcomes due to different skews in populations, whether you're living in a somewhat healthier country or a more unhealthy country, whether you skew more elderly like Japan or younger like Mexico, it's just going to depend on the demographic makeup. So until it goes throughout the world and it infects everyone, oh my God, can you hear the cat? She's making a lot of noise. I'll be surprised if you don't wind up hearing it. Until the virus goes throughout the entire world and runs its course, we won't really know the answers. But we have some solid estimates right now. The reason why people were initially concerned with the virus is because it appeared to have somewhere between a 2 and a 4% mortality rate. Now, when you compare that to the flu, it's about 20 times higher on the low end. And you say, so this thing was 20 times deadlier than the flu. Now, it appears like those estimates are probably going to be higher than what it winds up being. But we don't know that for sure. We really don't at this point. It's kind of up in the air still whether or not the virus winds up killing 4% of the population. I don't think it will. But then again, in places like Italy, the amount of deaths they've had is about 10% of the amount of reported cases they have. A lot of that is going to be due to a lack in testing. What you'll find is that as your denominator gets bigger, your mortality rate is going to appear smaller. So in places like South Korea, the mortality rate appears to be very low. But that's because they have tested everyone. And that's what you need to do. Of all the positive cases, the amount of people who die tends to be relatively low. My guess is when it's all said and done, the death rate around this thing is going to be about 0.5%. So still a lot deadlier than the flu, the seasonal flu, but not nearly as bad as it initially was projected. Part of the reason why it killed so many people in China is because the healthcare system is not great there, and they're more interested in covering it up than caring for the sick people. And also the Chinese population skews heavily male, and they're heavy smokers, which I didn't know prior to the onset of this virus, but apparently China, the population there smokes a lot more than other places in the world. So they have underlying lung issues, which is why it was killing so many people so quickly. So around a 0.5 maybe percent death rate. We won't know for a long time. So still deadly, still concerning. But the overwhelming majority of people who die have an underlying condition. Now, the problem is what constitutes an underlying condition. So obviously heart and lung issues, emphysema, COPD, asthma, these kind of things, bronchitis. If you have coronary artery disease, I think they're even counting high blood pressure among the list, which is basically everyone in the United States at this point. So you're talking about, especially in the United States specifically, we have a heavily obese population in the United States. Being obese leads you to heart issues. Having heart issues leads to death from the coronavirus. This disease is poised to hit the U.S. and Western countries, specifically Western Europe and the United States, hard because, unfortunately, we have a lot of fat people in our country. It's a blunt way to put it. And if you are obese, if you are hefty, you are at risk of being harmed by this virus more than the other average-sized people. So that's no good. But one of the reasons why, it's not because the disease is so deadly that the death rate is so bad. It's because it's so infectious. Now, it's called the R naught. It's pronounced R naught. R naught score, which is basically the how infective something is, like a virus. So anything less than 2%, not normally terrible. 2 to 4%, okay. Not great, but not the worst thing in the world. And then you have things like measles, which is like a 15 or something insane like that. So this is looking to be more like a 2, which means for every one person who gets infected, they're going to infect 2 more people. So it's like a pyramid. And you say, okay, well, that's not that terrible, except that if it's that infective, it can lead to exponential growth, which is what we've been seeing, which means you can go from, very few cases to 1 million cases in, less than 30 days. And you say, oh, well, that's not good. And then from 1 million to, well, basically, if it doubles every 3 days, you wind up with some serious numbers very quickly. So the R0 score is comparable to the flu. So if it's comparable to the flu and you get 80,000 deaths from the flu every year, then you say, well, multiply that by at least five, probably more. And that's how deadly this is going to wind up being. I've seen some estimates recently that plug it anywhere from 300,000 to 3 million. So it's a big range, and it kind of depends on how things go. We don't really know yet, but it's not going to be a small amount. And that, again, is going to skew heavily elderly. It doesn't typically kill people under the age of 40 unless they have health problems. So it's rare to be killed if you're young, unless you get a massive dose of the disease, or you are immunocompromised, or you have some sort of underlying respiratory condition. It's rare, but it happens. It can kill. It's killed healthcare workers who are young and relatively healthy, so that's a concern for everyone. But if you are elderly, if you are over the age of 60, for example, you need to be staying home. You don't need to get this disease. This disease is killing over 20% of people over the age of 80. I think it was 80. It's killing 20% of people over the age of 80 and somewhere 10 to 15% of people over the age of 60. That's odds you don't want to. That's a game you don't want to play. That's a chance you don't want to take. If you have a 0.5% chance, okay. But if you have a 10%, 15%, 25% chance, you don't want to play that game. That is going to be devastating. So those are just some raw numbers. How contagious it is, how deadly it is. Those are things, but again, we won't know for sure until it runs its course throughout the world. This is actually old data at this point, but there were 200,000 cases in 144 countries a week ago. And that number has grown, again, exponentially since then. So it's up and up and up and up and up. People don't understand exponential growth very well. It doesn't compute very well in our minds. Because if you say there's 1,200 cases, you say 1,200 cases in the U.S., not too bad. Except that when you double that number every day, it gets to be a lot very quickly. They don't understand. They understand linear growth. They understand something that's kind of up gradually like this, but they don't understand a 45-degree angle. They don't understand this, where it's just you're going to double, or you're going to have 33% growth either every 48 hours or 72 hours. And it doesn't compute very well in our minds. But that's the way this virus is going, and it's going to affect a lot of people. And it's going to be a problem. But it's not... This is okay. Here's where we take a step back. Here's where we say, all right, here's what you need to do, and here is the important thing to do. The important thing to remember is that there are going to be a lot of people throughout the world who die of this virus. There are a lot of people in the world who die from viruses all the time. This is different. It is. But it is not the end of the world. Every person who dies is a tragedy. You don't want people to die unnecessarily from a virus. So everyone has to do their part. But at the same time, we have to remember this. This is not the end of the world. This is not something that we all need to be panicked over constantly. It is not. We are all going to get through this. We're all going to get through this, and the overwhelming majority of people are going to be fine. But we all have to do our part to make sure that happens. So the things that everyone needs to be cognizant of. When people are asking you to stay home, you need to be staying home. At least for the next month. At least. I would say the end of April. We all need to be home until the end of April, at least. At the minimum. Now, I know it's going to be another 6 weeks, and you're going to say, this is shitty. I don't want to do it. I understand. It's not fun. It is important that everyone stays home, because here is the most important thing that we can do right now. Everyone has heard this phrase. Everyone in the world has turned into an epidemiologist, where you're talking about infectious disease as if you know what you're talking about. And everyone has now heard the phrase flattening the curve. That is what we need to do. We all need to do our part to flatten the curve. For those of you who haven't heard the phrase, it's kind of hard to explain without a graph, but I'll do my best. Imagine that 1 million people are going to get sick with the disease. Okay? And on this axis, we have how many people get sick, and on this axis, it's over what period of time. So if what we have at first is that from the first infection, we have a rapid spread, and it goes up to a peak, and then it comes down, that would be bad. But if we have gradual infection, the same amount of people, but over the course of a longer time, and it looks like a little hump as opposed to this big spike, we would be doing much better. Because the big spike, the reason why we're afraid of the big spike is that's what happened in Italy. If you have 1 million people who get sick the same day, and you only have so many beds in the hospital, so many ventilators to put people on, you have to make decisions you don't want to make. Who gets a bed in the ICU? Who gets to be put on a ventilator? This is something that Italy has had to struggle with, and we are probably going to struggle with here in the U.S. already. Imagine having to tell the family of an 80-year-old that we might be able to save your mom, your dad, but we have to give the ventilator to this 40-year-old because he has a better chance. So your parent's going to die. We just don't have the resources. That's what Italy has had to deal with. And that is what the U.S. is going to have to deal with. And probably a lot of other Western countries as well. People want to, for as much as people don't like the U.S. healthcare system, the U.S. healthcare system is actually better equipped than a lot of places to handle things like this because we tend to have the best people here in the U.S. in terms of our healthcare professionals. Our healthcare system is actually fairly solid. People don't like the cost of it. It's expensive, but it is really good. And we are going to be overwhelmed. So staying home is important for you and your personal safety, but more importantly for the entire country. The entire country is going to struggle with this in a way that most people outside of healthcare don't understand. But for those of us like myself who work in healthcare, we're already seeing it. There are already floors in hospitals dedicated strictly to COVID-19 patients. The coronavirus is already going through it's already infecting your healthcare workers at the place where I work, at the hospitals in the surrounding area. There are already positive cases among healthcare workers. And once your first line healthcare I just used the phrase. I've been making fun of people for talking about being on the front lines. Once your frontline healthcare workers go down, though, then you're in trouble. Because then we don't have people to care for the sick people. Or you have to send in sick employees to care for the sick people. It's no good. So stay home. Make a personal sacrifice a little bit. Avoid people. If you're in public, you don't need to wear a mask. It's not doing you much good. If you have an N95 respirator, you can go ahead and wear it. But if you're wearing a surgical mask, it's really not helping you. Don't worry too much about it. Wearing a surgical mask is actually good if you are sick. If you're sick, you should wear a mask because when you cough, it goes into the mask and doesn't spread all around. That's a benefit. But if you're just using it to protect your breathing, actually that's not what it's for. It doesn't really protect your breathing. You're not filtering the virus through a surgical mask. Again, if you have a respirator, go for it if you want to. You don't need to. But stop wearing the surgical masks. And unfortunately, the cloth masks that people are making at home, I just saw a study. It says about 97% of particulates get through those cloth masks. So again, it's a good... I understand. You want to help. You want to make some masks. It's not really doing anyone any good. You give them to sick people. But healthcare workers don't need them. Healthcare workers need proper PPE, which is a whole other thing. But we're going to talk more about some of the implications that this virus has had. But I think the important thing I want everyone to understand is it's serious. Everyone needs to take this serious. Do not think this is the end of the world. We are all going to get through this. We are going to be fine. As a nation, as a world, we're going to get through it. But what we all need to remember is that this is a dress rehearsal. One day a pathogen is going to come through. Exactly. Everyone in the world right now should be watching the movie Contagion. If you haven't seen it, you need to be out there and watch the movie. That is the fear of healthcare professionals, that we're going to have a virus like the one in that movie that kills almost everyone it comes in contact with. Then you'll watch the deterioration of the world order. This virus, it's going to affect the economy. It's going to affect the jobs. It's going to make life worse for a little bit. And then we're all going to get through it. We are. That's the important bit to remember. If you're young and healthy, you don't want to catch the virus, not because it's going to kill you. You'll get a little sick, more than likely, but because you don't want to spread it to other people. That's why you stay home. It's not because you have to be worried about your health. You're going to be fine if you're young and healthy. But you need to be responsible. You need to stay home for your relatives or for somebody else's relatives. You don't want to be the person who gets the disease, gets the virus, and then passes it to another person and it kills them. You don't want to be that person. So those morons you're seeing out there partying, having COVID parties, thinking it's funny to go through grocery stores and touch things, those idiots, don't be them. Be smarter than that. Be more responsible than that and more respectful than that. I just saw something, a woman coughed on $35,000 worth of food in a grocery store. They had to throw it all away. It's like, what are you going to do with that? And it's like she thought, I don't know if she thought it was funny but then it's not funny. It's not funny to make people afraid for their lives. It's not funny to walk around and lick doorknobs and do all these different things for a prank and doing it for the gram. You're doing it because you're a jackass. Stop it. We're gonna do another one about these. So this one was just a real quick overview. Don't panic. Don't get yourself worked up or stressed out or anything. If you are older, if you are sick, stay home. Don't stop hugging. Stop shaking hands. Just don't be around people if you don't need to be. There's no reason to put yourself at risk. And if you're young, stay home and do it for the old folks. The cat's going off again. I don't know if you can hear. It's craziness how loud she is. You hear it? Crazy. But we're going to do another one about these where we're talking about more about the implications. We'll talk about the stock market and the controversy around calling it the Chinese virus. We'll do all that. We'll probably do that tomorrow or Tuesday. I'm going to put out a series of these about COVID. We're going to keep going off about it. I know you're getting oversaturated with content about this already, but it's important. It is important. And I am in a position where it's a little unique because I happen to be more medically knowledgeable than some people. Not a lot. I won't say a lot of people, but I'm more medically knowledgeable than some people. And I do work in the healthcare profession. So it makes it a little bit, I understand these things just a little bit better than the average person. I'm not going to give myself too much credit. I'll say a little bit better than the average person. And we'll get over it. But please, here's the important bit. Any questions that need to be addressed, leave them on the video. Put them on an email, tcchrestman@gmail.com. Just go ahead and let me know. I will answer any and all questions I possibly can that people have. But for that right now, we're going to just leave it there for the day. And I will see you guys sometime this week for our follow-up episode talking about the politics of it. And I want everyone to just stay home, stay safe. Enjoy some time catching up on back episodes of the Chrestman conversation. And go ahead, if you haven't already done it, leave me a like, a review in iTunes. It always helps with our ratings and the algorithm that they use to recommend videos. So that would be appreciated. And with that, stay safe, stay home. Stay home. I'll say it twice. You guys have a good day. I'll talk to you later. Tyler Chrestman for the Chrestman conversation.